Hello, this is Dr. Lewerenz at Longevity Health Institute. Hope this finds you well. And I'm here in Rochester, Michigan. Thought I'd talk to you about a couple simple things that we see here all the time, and I guess three major players that can affect and help pain and chronic debilitating inflammation in the body, and things that often are a little bit overlooked. So one is this. We always approach somebody here at Longevity Health Institute and at Lewerenz Medical Center from a functional model, from a personalized approach. Everything's very personalized and detailed in a functional model, and we consider systems. And one of the main systems that we deal with is chronic pain and chronic inflammation. And what can affect that? Well, the other systems that we consider and look at can affect that, and that is genetics, hormones, gut health and diet, toxins in your body, and psychological or emotional even stressors. So these all can play a role. But let me talk to you about three things that are very impactful and can help you even right now, even today. You can go out or go to our website in order and or make an appointment and see us, and one of my practitioners, myself, can help. One is the herb and the medical component of the turmeric root, particularly curcumin. Curcumin is an extract from the turmeric root that is hugely anti-inflammatory, and besides being detoxifying and helping even potentially a little bit of blood thinning and helping circulation, and helping some cognitive things, there's research on that, and cardiovascular things. Curcumin is wildly and very impressively anti-inflammatory. So when I have a patient that has some arthritic inflammation or joint inflammation in that, we'll often use curcumin extract in a high quality form to take maybe a couple times a day, as if it's a Motrin, if you will, or an anti-inflammatory NSAID, and they'll get some not just health benefits, but some anti-inflammatory joint and pain benefits. The second thing that I want to share with you is, and again, one of the systems that is affected is in hormones. And many hormones play a role into overall inflammation. But one is very particular, and that is testosterone. And I mean testosterone, the sex hormone, for men and for women. Yes, women need testosterone. They don't need a lot, but they need a little. And with aging, due to adrenal decline and ovarian decline into menopause or premenopause, they'll often lose testosterone. And testosterone is a wonderful anti-inflammatory, energizer, bone stabilizer, libido enhancer hormone. But what's important here to understand is that if you have low testosterone, not only will you be tired and apathetic and not feel wonderful, but you will actually be inflamed and stiff and achy and all that. So patients, whether you're 30 or you're 70, if you have joint inflammation and joint stiffness and things like this, optimizing and us treating and bringing up your testosterone levels, obviously naturally, bioidentically, in a very personalized way, is very not only healthy, but can actually help alleviate a lot of pain, chronic pain and chronic inflammation. And again, whether it's your neck or back or knees or shoulder or what have you. Ironically too, which is a big kind of take-home message, a lot of patients that deal with chronic pain that are on a lot of pain medications like Vicodin, Norco, Percocet, all this opiates and stuff that people are taking for chronic pain actually lowers your testosterone. It's very correlated in studies that low testosterone is linked to opiate and chronic pain medication use. So consider that when you're dealing with chronic pain. Get your testosterone levels checked, men and women, and make sure that we optimize them. The third thing is that has to do, and we do here at Longevity Health Institute, and we can help you a lot with, and it's a wonderful old therapy, but is using Ozone, which is O3, a European model of therapy for pain and inflammation and healing. But ozone in the body reacts with organic compounds in the body when injected, and it's injected just like a shot or in a syringe. Ozone actually has a marvelous anti-inflammatory ability and a healing ability. And sometimes we put these into joints with or without PRP, which is platelet-rich plasma, which is a individualized injection of your platelets that have growth factors and stem cells in them that help those joints be less inflamed and not angry and achy and stuff. And when there's even partial tears and things, especially soft tissue, you can get some wonderful healing ability and anti-inflammatory ability. Ozone injections are very, very safe, no downside, no downtime particularly, and very effective for arthritis and inflammation and injuries to the back or spine or joints, what have you. So consider these things when you're dealing with chronic pain or arthritis or inflammation, and particularly in times like right now when it's the fall and kind of getting cold and wintry, wet and that, okay? But take this and do well with it. Hope this finds you well or gets you in the right direction and on the right healthy path. This is Dr. Lewerenz at Longevity Health Institute, longevityhealthinstituteinc.com, or call us anytime at 248-289-6643, and me and my staff will be happy to help you and get you in the right direction. Again, this is Dr. Lewerenz. Be well.